Hey, this is Dr. Jon Gundlach, and today I'm here with this handsome young man of 80 years old. The most common thing that people come in with is low back pain, shoulder pain, and knee pain typically. They're playing golf, some are playing pickleball, or they're hiking. Today we want to talk about his shoulder pain. I believe you fell once and separated your shoulder, is that correct?
That's correct, on the right side here.
Right. And so there's lots of ways people deal with this. Some just take pain medications, they'll do some physical therapy, and a lot will just try to wait it out. But if you want to get better quickly, there's some really exciting things that can be done. I do a special technique called active release technique. It's a special muscle therapy, and I'm going to show you. Just take your head, drop your head down towards the right, where we take the muscle through its range of motion, come back up. We're going to do that about 5 times. Go all the way up and all the way down. Keep doing that. Where we take the muscle through its range of motion, lengthening the tissue underneath tension, breaking up scar tissue and adhesions. And there's a move for every single muscle, ligament, tendon, capsule. We're going to get right into his shoulder capsule here. And you can see he has no external rotation. He should be able to get his arm back to here. So we're going to start to work this, and you'll see it'll loosen up pretty quickly because tissue changes quickly. You can take a tooth, put braces on it, and move it through bone. It's much, much easier to get muscle and ligament and capsule to loosen up. And you can see this is already loosening up. Does that feel okay?
Mm-hmm.
And again, it's a good hurt. So I work on a lot of athletes, but again, I can work on young people or older people, and we just go to the tension that they can handle so that everyone feels good. Let's check that posterior capsule. Now, after I do this work, and again, we'll work every muscle possible, there's also a laser that I have here, and this laser we can put on top of the shoulder, and you'd be skin on skin, but this laser will decrease pain and inflammation and speed up healing by 25%. All right, after the laser, I can also use this kinesio tape. You see this on Olympic athletes to support the shoulder. The tape can actually decrease inflammation, and it can also strengthen the muscles around it. So we'll put some tape on it. I'll send him home with some exercises, and then we do a lot of functional nutrition. One of my favorite products is Recovery. This can help get rid of inflammation and speed up healing. There's also other supplements that just support the tissue if you have any inflammation like that. So again, if you are at home sitting there and you've got chronic shoulder pain or back or knee or any other part of the body, and you've never tried this type of work, you've got to give it a chance because there's nothing else like it, and I think you'll love it. And again, I'm working pretty hard. These tissues get tight, so we're getting in there and clearing it out, and your suboccipital nerve comes right out the back of your head, right here, where it gets tight. And so we're just loosening that up. So we loosen that up, and then after that, after we loosen up, we'll give a little adjustment in here, just like that. Beautiful, and just stretch that out. Now, what also causes headaches is clenching. So you can work all of the TMJ muscles. So I'm going to have you just open your mouth wide. Good, and close. Just keep going back and forth. Excellent. And so you can work the temporalis muscles here. Keep going. That was just the masseters, now the temporalis. There's a little muscle called the digastric. Try to lift your jaw up towards the ceiling. Perfect. Good. Right in there. Bring it back down. One more. And then there's a muscle inside the mouth called the pterygoid. And those are classic migraine headache muscles. So we hit those as well. If you could start to sleep on your back, and then we're going to do some home stretches and exercises.